I'm Joshua Moon and I'm a research fellow at the Science Policy Research Unit in the University of Sussex Business School. I research what we know and often don't know about epidemics and pandemics. Through my research, I've found that pandemic response is often a knowledge-intensive endeavour. It's an extreme case of science policy. And for us, this raises three important questions. First, how can technologies help us to innovate our way out of the pandemic? So some knowledge is tied up in technologies like rapid tests, vaccines, or therapeutics. Various technologies are currently under development, which requires some systems to be in place. First, like with the Oxford vaccine, close links between industry and universities are needed to let knowledge flow between them. Second, regulators need to be adaptable to respond to what is and is not ethical and safe for clinical trials in an emergency situation. This must include discussion with diverse stakeholders to engage their views. Third, distribution and use of these technologies requires logistics to be in place and a consideration of how to ensure equity in who has access. But there are pitfalls to focusing on this technology. We already have non-technological approaches to pandemic response. The standard public health response of contact tracing, patient isolation, and contact quarantine have already demonstrated their utility in reducing the burden of COVID-19. So large sums of public money spent on developing novel technologies, often with issues in accessibility, equitability, and utility, raise the question of whether or not there's an opportunity cost in using that money for, say, building better public health responses or rebuilding more resilient health systems for pandemic responses of the future. But what this also raises is the question of why do countries have different responses to the same virus? So social, cultural, and political factors are major influences of how a country responds to a disease outbreak. This includes things like whether the health system is nationalised or privatised, whether the elderly tend to be cared for in the family home or in care homes, whether there's an extensive or limited welfare system, that transport links within a country can affect how a disease spreads and thus the response required. Even the way a city is organised, if it's in the block system like the US or urban sprawl like the UK, can have an impact on how we respond to an epidemic or a pandemic. The key is understanding that national context in which a response is occurring, right from the kind of global understanding of health all the way through national and even down to local level responses. And so that context is really what drives our understanding of how technology is used and how we respond to the pandemic. For more information on work like this being conducted in the business school, follow these links.